Happy Mental Health Awareness Week. Now that probably sounds like a little bit of a weird phrase to hear, and it certainly feels strange to say, but let's just go with it for right now. And I'm going to say we when I'm talking about this stuff because it applies to me as much as it does to anybody else. We do a tremendous job as midwives. The hard work of being with women and their families as they come into their own in parenthood is really and truly appreciated, and all of the emotional work that we put into that is crucial. But midwifery comes with a whole bunch of occupational hazards. Empathy is what makes us great, but it also appears to make us vulnerable in some circumstances. We, as midwives, are at increased risk of stress and burnout and mental health issues such as anxiety and depression and PTSD. Now, we all know that hormones are really useful. Oxytocin is great for falling in love. It's really useful for labor. But too much of it can cause uterine hyperstimulation, which is not a good thing. In the same way, stress hormones like adrenaline and cortisol are really, really useful and really helpful to us in certain circumstances, but they can fire off in ways that we don't always like. But this happens as a normal response to an abnormal situation. And we are in abnormal situations all the time. And when we're finding them difficult, we can often feel like it's a situation that we're failing at because we are failing to cope, instead of seeing that the situation itself is a tremendous amount to carry. You may know someone who's feeling like this right now, and you yourself may be feeling like this right now. If you get a bunch of our colleagues together in a room and you look around the room, probably almost all of us in there will have felt like this at some point or another in our careers. Almost all of us are walking wounded in some way, and I include myself in that. We need to look after ourselves. We know that if somebody's experiencing a knee problem or a joint problem, or they're having some other difficulty that's affecting them at work, we need to find out what to do to speak up about it, to sort of make things better. And we need to do this from a mental health perspective too. There's evidence to show that talking about difficult or traumatic things can help get our brains to sift through all of the things that it needs to and to sort out what needs sorting so that we're able to get back to our usual fabulous selves. Sometimes talking to friends and family can help. Sometimes there are not always the right people to help us sort out what's going on. We can access things through work, things like professional midwifery advocates or well-being services. HR can sometimes be useful. GPs, sometimes there's a place for them, a role to play. Of course, for anybody who's in a really urgent situation, the Samaritans or even 999 can be the right people to talk to. There aren't any instant solutions, but there are things that can be done to help us to heal our scars. I'm wishing you a very great week, being aware of looking after mental health both in yourself and in other people. You're probably doing a better job as being a midwife than you realize that you're doing.